Hello and welcome to Senior Speak New Hampshire. I'm Dan Wise, your host and a volunteer for AARP New Hampshire, which is the sponsor for this show. I also work on the staff of the New Hampshire Commission on Aging, a small state agency that provides advice and information to the governor, legislature, and general public on issues regarding aging, and we basically advocate for policies to make our state a place where everyone of any age can live and thrive. In the course of my work, I've come to know Susan Buxton, who is our state's long-term care ombudsman. It's a little known but important responsibility to be an advocate for people living in long-term care facilities. So I've invited Sue to be our guest today and talk about long-term care, the good, the bad, and the room for improvement. So, welcome, Sue.
Thank you.
Thank you. So, can you first tell us what the Long-Term Care Ombudsman's Office is and what your responsibilities are?
Sure.
There?
So the Office of the Long-Term Care Ombudsman is an Older Americans Act program, and every state that receives Older Americans Act funds is required to have an ombudsman program. So first and foremost, we're resident advocates. We provide advocacy for individuals that live in nursing homes and assisted living. But we also provide education and consultation to providers to help them with navigating challenging situations, understanding best practices in ways to deliver care. As the state ombudsman, I do more of the systemic advocacy. Within our office, there are 4 regional ombudsmen who visit the facilities. They each have a region of the state and cover the actual, individual advocacy. We take our direction from residents. We're completely confidential. People can call us and talk to us about things. We are the only individual that a resident who lives in a long-term care setting can talk to about abuse, neglect, or exploitation, and we are not mandatory reporters. And the reason that I always share that is because it really speaks to the relationship that we have with residents. And if you imagine living in one of those care settings and you want to talk to somebody about an interaction you may have had with a staff person, the minute it comes out of your mouth, you lose control of it. But they can talk to us about it, and we can decide together how to approach it. As the state ombudsman, I do have the authority to override a resident's wish to keep something confidential if it really rose to the level of a danger to others. So that's the nutshell.
And how many facilities, or do you know how many facilities, or how many people are in this
there's
kind
about 80 nursing homes and somewhere around 150 assisted living facilities, and I'm not great at the exact numbers.
And so you mentioned about mandatory reporting. So that's something where. So what are the kinds of issues that people bring? What's most likely that what people bring?
So I think right now, and I'll answer that a couple of ways. So because we are a federally mandated program, there is a set of complaint codes that every ombudsman program across the country uses, so that we can report and they can gather data for our federal delegation to understand what's happening in long-term care. It goes anywhere from something very simple like food choices to response to call bells, which is a big one. We hear about access to health-related services. So, I really need to get a new pair of glasses, and I've asked for that, and I don't get an appointment. I want to see a specialist. All matter of health care. To complaints about being mistreated. By a staff person, or maybe it's a family or another resident. We do conflict resolution between residents. As you can imagine, when two people have to share a pretty small quarters, sometimes
Yeah.
that doesn't go well. So there's room for some mediation.
And there's also, and you mentioned the issue of maybe exploitation or abuse by a
Correct.
family member. So do you get into kind of the financial exploitation? Is that something you might end up getting involved with?
We aren't really, we go to a certain level. So we would really help the resident with understanding what their options are, but then that would go to Adult Protective Services to do the investigation and, if necessary, beyond that for prosecution, if that was the case.
Mm-hmm. And how do people who are in these, in a nursing home or assisted living, how do they know to call you? Where is there requirements about where the number is or when they're given that?
Yeah, so facilities are required to have it posted in a prominent location so residents can see it. They give it to residents at admission. And we do quarterly visits. I mean, the ombudsman go into facilities, so they try to get to know people. We also have a volunteer program. So we have volunteers that also do visitation in facilities.
Oh, and so then the volunteers kind of just report back to you if what they
work
feel.
hand in hand with the regional ombudsman.
Oh, okay. So yeah, you mentioned there were quarterly visits by the regional folks. So they're seeing every facility at least.
They're trying to.
Trying to every.
Yeah. We prioritize complaint calls first. We have to triage, and as you can imagine, with the geographic size of New Hampshire, with 4 regional ombudsmen, they don't get to every facility quarterly. That's our goal. And there are some facilities that they absolutely are able to accomplish that, and then there are some that are smaller that we might not get there quarterly.
And what do they do when they visit? They're not like inspectors. They're not coming with a checklist and things like
they're
that.
not. They're paying attention to what's happening. They usually, one of the services that we provide is we support resident and family councils. So we'll help with getting one established. We'll help with support in any way that they need to keep it functioning. So if there's a resident council chairperson, they're certain to go visit with them and ask for feedback. They're really just out and about meeting with people. They usually have a staff person that they check in with, whether it's the director of social services or the administrator or a nurse leader, to ask if there are residents that they think would benefit from a visit.
One thing I was curious about, and I probably should have done it right up front. What is your background and what's your background and experience coming in, and how long have you been an ombudsman?
Yeah, so I've been the state ombudsman for about 9 years, actually. And I come from a background, I'm a licensed nursing home administrator, and I've worked in senior living and long-term care for most of my career. That's a little unusual across the country. A lot of ombudsmen come from, they're social workers. There's a number of them that are attorneys. There's a variety of backgrounds.
But the job description is pretty much the same for the ombudsman in the different states.
Yep. The states have different models of the way that they run their program. New Hampshire has a centralized program. Some states have decentralized, so they would have a state office and they might contract with an area agency, or I know AARP does it in some states. So they would have local ombudsmen that contract with the state office. But we are centralized in New Hampshire.
Okay. Now you mentioned nursing homes and assisted living, and we've talked about this a little bit, that there were different levels of regulation for different levels of care, and I wondered if you could kind of go through that.
Sure,
go through
just,
what the levels are.
and I'll try to be quick about it. There's obviously,
it's
so
pretty-
nursing facility is licensed by the state, but it also has federal licensure if they participate in the Medicare program. So that would be considered a CMS facility. And then within assisted living in New Hampshire, there are two different levels. There's the 804, which is residential care, and so I say it's a little bit lower level of care. So it's more of a residential model. And then 805, supported residential care, which has more medical services and really can take care of, depending on what services the facility chooses to provide, they can take care of pretty complex medical issues.
But it's not necessarily at the level of being a nursing home.
It could be,
could
but
be,
it doesn't have the CMS certification.
Oh, okay. Now, what about memory care type facilities?
So memory care
Is that-
in New Hampshire is not a licensed level of care. There are no additional regulations.
So it's just a subset of the nursing
Assisted
home
living,
or assisted living?
either one. You
So
could,
it could be in either one, and when you see somebody that's someplace that says it's memory care, it's not licensed as such. The state
Correct.
doesn't have standards. Is that a problem, do you think?
I would like to see it be, to have a set of regulations, because I think it would be easier for individuals that are trying to choose that level of care, because they really do vary. And I think in states that have regulations, they have, for instance, they have staffing ratios, requirements to be able to maybe, these are some of the things that I see in some of the regulations. Access to the outdoors so that individuals can go outside at will, would be a protected environment. But, those levels of activities that are provided, the training. New Hampshire does require all staff to have dementia care training. But those are the things that, an additional licensure would provide that guarantee that that's what's happening in all of the facilities.
So now when there are, one thing that I want to get into too is about what guidance you'd give to people about how to pick a facility and what to look for, because well, first of all, I guess directly to your position, when there are complaints in a facility, what happens to those? Are those public? What's the status of how you could find out about their record?
Right. So there's two different ways to look depending on the licensure level. So the CMS certified facilities, Medicare.gov or CMS.gov, the 5-star rating will tell you about inspection results. They also have a number of clinical criteria that they rate facilities on. Staffing levels, weekend staffing, a percentage of pressure sores, all kinds of criteria. Within assisted living in New Hampshire, it's the Office of Professional Licensing and Certification, so oplc.gov. I'm happy to report that we're halfway towards having a change in the legislature, the laws in New Hampshire, that currently the law does not provide for the results of life safety inspections and complaint inspections to be made public in assisted living. Those are kept confidential by the state, but we're halfway through the process. It's passed in the House of Representatives and now needs to go, in the Senate and needs to go to the House of Representatives, that those will be public.
So those would those be posted, or would those be accessible in some way?
They would be
through the
accessible
websites or something?
online.
I see, yeah.
In nursing facilities, they're required to post them. And
Okay.
in assisted living, they are required currently to post the annual health inspection.
And a life and safety inspection is something different, though.
Yes.
Oh,
And,
okay.
and to my thinking, very critical when you're looking for a facility. You want to make sure that it's safe. Those are the things like the fire alarm system has been inspected, that, they've done fire drills, all of those building safety pieces that, you would want to know.
Now, one thing that I've found is that there are some facilities where they don't evacuate if there is a fire, because it's a nursing home and people are really not they're not mobile. Most of them are not mobile. Is there a different kind of precautions taken for that? I mean, how can you tell that that's a safe situation?
Well, those are the kinds of questions that you would want to ask. In a nursing home, the requirements for building, the code for the construction allows for a defend in place. So it's built to be able to protect an individual for, usually it's 1 hour, and then you have a compartment that might be 3 hours, which would allow for emergency personnel to help with an evacuation if that was needed. But in some assisted livings, particularly those supported residential care facilities, some of them are built to the life safety code, the healthcare life safety code. So that's a question you'd ask. What do you do in the event of a fire? Do they have to evacuate?
Yeah, and then and if they don't evacuate, there's ways where they seal off a hallway, or they seal off rooms even.
Well, if it's not built to the healthcare standard, if it's wood construction, and that's a big part of the difference, is the framing is wood, then you can't stay in a room and be protected from fire.
Yeah. Now, there's something like in Medicare, there's for nursing homes, there's like Medicare ratings, 5-star, whatever. What are those composed of, and are they effective? And what else should a consumer, a caregiver or the older adult, what should they be looking for? How can they evaluate a place?
Right. So I think that's one of the things you look at, but there's a number of things. So, the 5-star rating system is a great starting point, but it's a moment in time. And when the inspection happens, and it's based on where they fall among other. So I'm sorry, it's hard to explain the whole system very quickly, but you could be the same, performing in the same exact way, but if another facility performs better than you, your rating can change. So it's I tell people the most important thing is to visit, because the environment of care, what I'm looking for and what you're looking for may be very different. And so you want to look at what's the setting, how large is it, what kind of food delivery systems are available. I don't think that you can, there's anything more telling than to observe. So do the residents look comfortable? Does there appear to be a natural relationship between residents and staff? And do they appear to recognize the staff and have a relationship? Are there activities going on? Some people want fancy, some people don't want fancy, and so that's a personal choice. And then when it comes to assisted living, you have to be really diligent about understanding what services they provide and what the charge structure is, because they're not the same from one to the next. And so there's a resident contract, and there's also a disclosure statement that are really important to review to understand what you're going to get and what it's going to, and what the charges are going to be.
Now, is there any kind of standard about the access to nursing, or like whether there's a nurse on all the time? Or
right. Those are the questions you have to ask, because it isn't the same from one facility to the next. And it's a great question to ask: is what is What is your staff to resident ratio? What's your nurse to resident ratio? What's your LNA to nurse ratio? And do you, for assisted living, do you have a nurse on 24 hours a day? Because they don't all have a nurse. They may have, you know, LNAs or personal care attendants that are on. And you know, that's a choice that you're making when you're comparing one facility to the other. Do they have air conditioning? Do they have a generator? And if so, what does that generator power if there's a power outage? Do they allow refrigerators in the resident rooms? You know, those are the house rules. If somebody's a smoker, that's an important question to ask, because they're facilities that allow smoking are becoming fewer and fewer.
And the refrigerator thing, that's an interesting, that's an important one, because I've seen sometimes the food is, you know, it's just not to somebody's taste.
Right.
And
Right, and they might want to supplement with something that they want to have control over in their room. Most all of the facilities have a community refrigerator, but you know, we hear lots of times that they put something in there, and when they go to get it, it's not there, you know.
It's like the roommate situation.
It's the roommate situation, or in my case, you know, a big brother.
Yeah. And is there anybody, do you get calls from people wanting to get your advice about a particular place, and is that something you're limited to?
Yeah, we don't share all of our information. We hold confidential, so we don't share our personal observations, but we do help people with sorting through information. So, you know, really feel free to call us if you're in that position, because we also, you know, we can supply a list of facilities and really just help. You know, people are oftentimes not ready to make that decision until it's upon them, and it can feel really overwhelming, and we're happy to help people think through that decision-making process.
In my own personal experience, my father moved, my father and my mother moved into a continuing care community, and they moved before there was my mother was cognitively impaired, but still, you know, safe. But my father was kind of going stir crazy because he couldn't, you know, wasn't getting out very much. So they moved before they had like a precipitating event where somebody was, you know, kind of physically immobilized, or you know, in bed or that kind of thing. And I kind of got the sense that really, you get to a certain age, you really should start investigating the options for having some support in your life before you need it. Because by the time something happens to you, and by the time you find something, you could need more care than what you, because you can be a kind of a steep slope. And so I kind of say, you got to be ahead of the curve. You got to be thinking ahead, because if you just do it when something happens, it'll be you're going to be under stress to make a decision quickly, and you won't really have the luxury to weigh your options.
And I think, you know, right now there's the added challenge of staffing. So a lot of facilities are not able to have all of their beds open, so they're limited in the number of admissions. You know, it's a call that we've gotten in the last few years now, but of individuals that needed skilled nursing care after a hospitalization, and the only bed available was 50 or 75 miles away from home, and now they're there and they want to get closer to home. And so they'll call our office to help advocate for that transition. So, knowing, getting out and looking, so if you are faced with an emergency, you sort of have an idea of where, where you think you know, you would want to go is good advice, Dan.
Yeah. Is the staffing shortages, is that pretty much all over the place in New Hampshire?
Yep.
Yeah, there's not like...
Yeah, I mean, you know, some areas and some facilities are doing better than others. You know, I think investing in your workforce is important. We see that, you know, facilities that have some continuity in the leadership do better with their direct care staff than ones where there's a lot of turnover. You know, some areas are, you know, more challenged than others geographically just because of the competition of other jobs. It's, you know, I would say that a high percentage of the complaints that we're involved with have a foundation in staffing.
Yeah.
Staffing challenges.
The call bell or
Yeah.
people being overworked
Yeah.
and not really handling
Right.
things well.
And I think, you know, we've always talked about in long-term care the value of a nursing assistant, and I don't think, you know, they never have, and they probably never will be compensated the way that they deserve for the work that they do, because they are so critical. And when there's staffing shortages, they're missing out on the intrinsic value, which is the reason that a lot of them go into the work, which is feeling good about helping people.
Yeah.
And it's hard to recover from that burnout at the end of a shift. That if you feel like you didn't do a good job.
Yeah, it's on the other side of the coin. You know, the people don't feel they're not getting served. They're not getting served promptly. You know, but as you point out, the quality of life of the worker and their ability to do that job sat in a fulfilling way is also endangered by these shortages.
Yeah, they really are, and I think you know, saying thank you goes a long way.
Yeah, there is one other thing I would quickly touch on, and that is that a large portion of the patients in nursing homes are on Medicaid, and we've got some developments in Concord and in DC where Medicaid funding looks like it's going to be cut in one way or another. And I was just wondering how, from your perspective of seeing what happens on the front lines, what's your level of concern about that?
My level of concern about that is very high. I think that the real people will get hurt if there's any cuts to Medicaid. But depending on the level of cuts, it could disrupt the healthcare system for everyone. It's critical funding, and I people need to reach out to our federal delegation and remind them how critical that is to the health of the healthcare system. It's a scary time.
And it really affects everybody, because it affects care for pregnant women. It affects early childhood, and it also affects how long or whether there's even an emergency room for you. Because one of the things that I've found in coming to work for the Commission on Aging is that the long waits in the emergency room are often due to the fact that there's no hospital bed upstairs on the nursing floor, because they can't send somebody to a nursing home facility because there's no bed available for them. And so you've got beds on the floors of the hospital upstairs, and that means that they can't take an emergency room patient and admit them, which means somebody's in the waiting room suffering.
Right. And I think likewise we're seeing, we work with individuals that are in long-term care that want to transition back out into the community, and finding the home care service and finding the housing. So there's there's backlogs at every point in the system of care, and it requires all of us paying attention to it. And disruption to the Medicaid system. I mean, in New Hampshire, we're faced with losing the Medicare Advantage, the Medicaid expansion program, which is going to affect a lot of individuals.
Yeah. Well,
So-
thank you for coming in on that.
Yeah, on that can we end on a happier note? Is that
happier note,
there's some great caregivers out there. There are some good facilities that are doing great work, and thank goodness for that safety net for people that need 24-hour care. So thanks for having me.
Oh, thank you, and thanks to the LNAs and the nurses who are on the front lines in a very unglamorous but potentially satisfying job if they get the time.
Right.
Yeah. Well, thank you very much, Susan.
Okay,
and I just want to put in a plug for the AARP website, aarp.org. There are a lot of resources if you need help figuring out what questions to ask regarding long-term care. You can also there is a phone number and an email address that we'll have on the screen for you about how to contact the Long-Term Care Ombudsman's office. And I also want to give a plug. If you have an idea for a topic for me to do a show on, you can write to nh.aarp.org and put Senior Speak in the subject line. And I'd love to hear your story ideas. Thank you very much, Sue.
Thanks.
All right. Thank you. Until next time.